We will be discussing about medical abbreviations and acronyms used in drug therapy. Okay, first in line we have the acronym or the acronym AD. So AD stands for Oris Dexter. Okay, so oris is a Latin word which means the ear, and dexter means right. So in medical English, that is a AD means right ear. Now next we have AS. Okay, so AS stands for oris sinister. Okay, again in Latin, A. Okay, the oris, that means ear, and sinister means left. Okay, that's why oris sinister or AS means left ear. Now we have AU. AU means oris ultraque. Okay, our AU stands for oris ultraque, or in medical English, that is both ears. We have the letters HHN. So HHN is the handheld nebulizer. So it is a kind of nebulizer wherein it is portable. You can bring it anywhere with you. Okay, HHN stands for the handheld nebulizer. So we have a parenteral administration site, which is the intradermal route. Okay, ID is intradermal route, wherein you would inject a substance or a solution or a medication into the dermis. Okay, so into the dermis. So if you see here an illustration of the layers of the skin, you would be injecting the solution right in the dermis to create a bleb. Okay, to create a bleb. Okay, so that's an example of an intradermal injection. So ID is intradermal route. Okay, so next we have the IM. Okay, so IM stands for intramuscular route. So in this illustration, we are going to inject the medication into the muscle. Okay, into the muscles. So IM, it should be here. Okay, now next to that is your intrathecal route. The intrathecal route is an administration of any medication into your spinal theca. Okay, so right here sa imuhang spine. So that is your intrathecal route. Now, next we have the IV. IV stands for intravenous. Okay, so any medication or the administration of any medication or other solutions into the vein. Okay, that's intravenous or the IV route. So, next to that is your IVP. Okay, so it's still in the intravenous vein, but you are going to push the medication, okay, to administer the medication into the vein, okay, in a pushing method. Okay, so your IVPB is the intravenous piggyback. Okay, your intravenous piggyback would suggest that you would be preparing for another line of your intravenous fluid or any medication. So if you have here your main medication or you have here your main IV. Okay, so if we have here your main IV to your patient, then your intravenous piggyback. Okay, so we have an injection port here. So that is your this in the injection port. That's where you will inject or insert the another line. Okay, that will serve as your intravenous piggyback. So that's IVPB. So next to that is your NGT. Okay, your NGT stands for nasogastric tube. Okay, so nasogastric tube. From the word itself, from your nose, okay, from your nose down to your stomach. Okay, from the nose, a tube from the nose that goes to your stomach. That is for the nasogastric tube. So next we have the OD. Okay, so we have the word OD. Your OD stands for oculus dexter. Okay, your OD is oculus. Oculus is the eye, and your D is the dexter. Okay, so that's oculus dexter, or in medical English, that is the right eye. Now we have the word, or we have the abbreviation OS. Okay, so what is your OS? Your OS is your oculus sinister. Okay, your oculus sinister. Now next we have the OU. Your OU stands for oculus ultratic. Ultraque. Okay, your oculus ultraque. So that is your OU. So next to your OU we have PO. Okay, per orem. Okay, per orem or by mouth. Okay, we have PR, that stands for per rectum. Okay, per rectum. Okay, or by rectum. We have sub Q, that is the abbreviation for the subcutaneous. Okay, sometimes SQ, sometimes sub Q. Okay, and we have sometimes subcut. Okay, so all the same, it stands for subcutaneous. Next to that is your AC. AC stands for before meals in medical English, because AC in Latin is antisebum. Okay, AC is antisebum. Okay, so next to that, adlib. Adlib is as desired. Ad libitum. Okay, so your ad lib, that is as needed or as desired. Okay, sometimes this ad lib, ang ilang gamitan sad is AD. Okay, some doctors would use as desired or as needed, ad libitum. So ASAP is as soon as possible. Okay, we have the BID. Okay, so BID, so that's twice daily. Okay, so ikaduha sa isa ka adlaw. So your BID stands for bis in die. Okay, bis in die. Okay, bis in die, twice a day. Okay, your HS is ora somni. Okay, your HS is ora semni in medical English, that is at bedtime or hours of sleep. Okay, so we have NOC, that's nighttime. Okay, nocturnal. Okay, nocturnal. That is for nocturnal. That is for your NOC. Your PC is after meals, because that means post sebum. Okay, your PC is post sebum. Okay, your PRN is as needed. Okay, as needed ang PRN. PRN stands for pro re nata. Okay, PRN stands for pro re nata, or it means as needed or as the circumstances arise. Okay, so that's pro re nata. So kung kinahanglan lang. Okay, so para dili maglibog your ad lib or as desired. as desired lang yun na siya. Okay, we will take as needed into it because as needed, that is PRN or pro renata. Okay, so your Q, okay, that means every. Okay, so every means kwake. Kwake. Okay, kwa or kwe. Okay, your QAM, that's every morning. Okay, so every morning. Your QR, that's every hour. Your QD is every day. Okay, QD is every day. For QD, that's every day. That means kwake dai. Okay, kwake dai. It means once a day. Okay, so your QID, that stands for 4 times a day. Okay, so because QID means your QID means quarter in dai. Okay, I'll put it here. Quarter in dai. In dai. Okay, so it means 4 times a day. Okay, so that is for your QID. Now, your QID means every, or QOD means every other day. So, because QOD is kwake, your kwake altera dai. Okay, or that means every other day. Okay, so that's for the QOD. Okay. So next we have the Q1 and we have this symbol right here. Okay. So kanang degree symbol, that is, it represents R. Okay, so if it's Q1 and then there is a degree sign, that's every R. Okay, or Q2, that's every 2 hours. Okay, or Q3, 3 hours, and so on and so forth. Okay. Dosage forms, we have AMP, that stands for ampule. Okay, cap or caps, that's capsule or capsules. Your DS stands for double strength. Okay, double strength is the DS. Your elix is the elixir. Okay, elixir is another kind of a liquid dosage form. Okay. Same sila ni syrup, but the elixir is more of a alcohol base. Okay. Then the syrup, which is more of a sugar based liquid dosage route. Okay, or liquid dosage form. So your LA stands for long acting. Okay, LA stands for long acting. Your LIQ or lick, okay, that stands for liquid. Your sol, okay, that's for solution. Your SUPP, that's your suppository. Now, it's not SUP but SUPP. Okay, so the proper way of writing it is SUPP and not SUP only. Okay, so SR stands for sustained release. Okay, especially in capsules. Okay, there are sustained release capsules. We also have suspension. Okay, SUSP, suspension. So, dili ibaylo imong suppository ag suspension. Okay, dili ibaylo ang suppository suspension because this is one of the most common nga mabali no nga abbreviation ng suppository and suspension. So SUP is for suppository, SUSP is for suspension. So we also have SIR, that means syrup, and TAB for tablets, and tinct or TR for tincture. So these are the abbreviations for the dosage forms. Let's proceed to the solution measurements. Okay, so solution measurements is your CC stands for cubic centimeter. Okay, your GM is the gram. Your GR is the grain. So do not use GR in gram because GR means grain. Okay, it is an apothecary measurement while a gram is a systemic measurement. Okay, unit of measurement. Your GTT, okay, that is drops. Why GTT? Because GTT stands for gate. Okay, so put it here. Gute. Okay? So, mo na siya ang meaning ni drops, gute, or GTT. Your IU stands for International Units. Okay? It's better if we write this out because sometimes tayo masayup aning IU. Okay? So, next we have the kg, that's kilogram. L for liter. MCG for microgram. Okay? So, it should be written out for safety issue. Okay, dapat i-spell out good ang MCG or microgram. Now, kay usahay man good, masayop ta basta yung pagbasa nato sa MCG, mahimo siyang milligram. Okay, so lahi na sila. So, mg, that stands for milligram. Your mec is milliequivalent. Your ml is milliliter. Your mn is minimum or m. So, dili kinakain ni siya ginagamit ang minim sa mga computation because we are using a standardized form which is the systemic unit. So, ang minimum good is an apothecary unit. So, we also have OZ, that's ounce. SS, that means 1/2. Okay? SS means 1/2. Pero, dili kita magamit og SS. Okay? So, it's an archaic use. Okay? So, we have sliver. Okay? So, in your neonatal intensive care unit, it's a small slice of a suppository. Okay, so gamay nga slice sa suppository. So ang kato suppository tungaon pa gyud siya, gamay lang nga slice adto, that's a sliver. Okay, so we have T or TBS for tablespoon and TSP for teaspoon. So these are some of the most common abbreviations in solution measurements. Let's proceed to now we have the miscellaneous usage in the hospital. Okay, mo ni siya ang mga kasagaran nga abbreviations nga makita nato sa mga chart sa patient or record sa patient. Okay, so if we have AMA, that means against medical advice. Okay, meaning ana ning gawa si pasyente or ning pugo si pasyente og discharge maskin og wala pa gi-suggest sa doktor. Okay, that's against medical advice. Or sometimes DAMA. Okay? Discharge against medical advice. Okay? So, kani we have C and then na ay bar sa taas. Okay? So, C, that means with. Okay, makita niyo siya sa mga charting. Okay? DC is discontinue. Okay? DC is discontinue. It's different with DNC because the term DNC, that's dilatation and curettage. Okay? Dapat DC lang siya. That means to discontinue. Okay? Your G is for the gauge of the needle. Okay? Then your HO is the house officer or doctor on call. Your KVO stands for keep vein open. Okay, so that's around 10 to 15 drops per minute ang KVO. Okay, para mo open lang ang vein. Your LOC may stand for level of consciousness. Okay, kung sa neurological exam pa. Okay? Or sometimes laxative of choice. Okay? So, mas maayo nga ang LOC dapat ikuan siya. I-spell out gud siya kay basig ma-misinterpret, okay? Sa mga nurses or sa uban nga medical practitioners. We also have MR, then X with a dash. So, that means may repeat for pila ka times. Okay? For example, MRX2, that means may repeat 2 times. Okay? So, pero dili na kayo niya siya ginagamit. So, dapat i-spell out or written out yun na siya. Okay? Para ma-avoid ang mga errors in interpreting these abbreviations. We also have MOC. Okay? So, MOC in pediatrics, that's the mother of the child. Okay? Mother of the child. So, FOC, father of the child. Okay, pwede po na siya frontal occipital circumference. So, mas better nga i-spell out gyud kung unsay meaning ani nila nga mga abbreviations. Okay? So, we have NKA, no known allergies. Okay? Walay allergies sa pagkaon, walay allergies sa tambal. Okay? No known allergies. Okay? So, your NPO, it's nothing by mouth. Okay? Nothing per RM. Okay, that's your NPO. Nothing per RM. Okay? So, we have OTC, that's over the counter. We have QS, okay, sufficient quantity. Okay, that's sufficient quantity. QS. Okay, so, makita nimo ni sa mga reseta sa sa mga reseta sa doctor ang QS. Okay, for example, apply the cream into the affected area, QS. Okay, insufficient quantity. So, your RX means prescription. Okay? So, ang kaning treatment nimo, okay, TX lang ni siya. Okay? So, kaning si treatment, TX lang ni siya. Your R, dayon na ay lingin, okay, around sa R. Okay, sometimes registered, but sometimes right. Okay? So, if you have this one, S, then ay bar sign sa taas, that means without. Okay? Without. So, pero, if duha ka buok ang S, okay, then ay bar, that means 1/2. Okay? If duha ka S, dayon na ay bar sa taas, 1/2. But you should avoid this form para prevent ang error in interpreting abbreviations. We have TO, that's telephone order, or kana siya usahay PO, phone order. Okay? Pero depende siya sa hospital policy if gina-use nila ning abbreviations. Okay? Phone order or telephone order. Okay, we have the TRA, to run at. Okay, to run at. Okay, it refers to the IV flow rate. Your VO is a verbal order. So, depende po ni siya sa policy sa hospital kung i-use ba nila ning abbreviation ng VO. So, verbal order kanang mga order ni doc para sa pasyente nga wala gisulat. Okay, wala gisulat or wala gitawag, giingon ra niya verbally. So, in writing down any verbal orders, dapat i-document ninyo siya. Okay, i-document ninyo any verbal orders. Then, later, if na si doctor or available na si doctor, dapat signan ninyo, ibutang ninyo, i-indicate ninyo ang time kung kanus naghatag verbal order si doctor. Also, the date, the orders. Okay, dapat kung unsa tong giingon niya mo, ibutang ninyo sa chart. Dili pwede kulang, dili pwede punan. Okay? So, and then, if available na si doctor, let the doctor countersign it. Okay? Also include in the verbal order or in any telephone order the signature of the nurse. Okay? So, signature ni doctor and then signature pa ni nurse. Okay? So, kaning duha. Okay, so this one, that is greater than and the other one is less than. So, these are the abbreviations used in the hospital. Okay? Pero depende gihapon na siya sa hospital policy kung unsa ang ilang gina-follow. Okay? So, these are the abbreviations to avoid. Okay? Kay naa sila yung mga parihas nga mga meaning. Na siya'y pwedeng ma-put siya into risk for any errors in interpreting these abbreviations. So, we have this one, UG. Okay, so micrograms. Okay, so dapat, kung pwede, MCG, or kung dili MCG, dapat spell out na lang yun nimo ang micrograms. Okay, your SS. Okay, so 1/2 should be written clearly. Dili kay SS lang. Okay, kay base masayop ka, pwedeng mabutang nimo na siya ng without, or pwedeng ma-interpret sad siya nga as 1/2. Okay, your OD. Okay, common kayo na siya sa mga order sa doctor. So, pwede man good siya order daily. Okay, pwede po siya masayop na to QD. Okay, so common ni siya. So, we have the N. Pwede man po good na siya nightly. Kung nightly man gani, use HS. Okay, hours of sleep or aura somni. Okay. For D, tarungon siya, okay? D, pila ka days. Okay, 1 day ba? Or 2 days ba? Depende. Okay, your BT, so na ibang hospital nga, pwede ni siya og kuan. BT stands for blood transfusion. Okay, na po ibang hospital, bedtime. So, kung bedtime ang galing ni siya, better nga gamiton ang HS.